I know that you just returned from ACC, and there were some exciting findings presented in your field there. Do you want to kind of walk us through what you saw or kind of set the scene for us?
Sure. So there were two new trials that examined the use of Tavor in low-risk patients. So patients who, if they underwent surgery for aortic valve replacement, are actually low risk for surgery. We already know that Tavor is non-inferior to surgery and even in some cases superior to surgery among high risk, prohibitive risk, and intermediate risk patients with aortic stenosis. But these studies really wanted to answer the question of how does Tavor perform compared to surgery in patients that are low risk for surgery. And so everybody was very excited to find out that Tavor did very well in the two studies. And so one of the studies included the SAPIEN 3 valve, and the other was the core valve. And so both had similar populations of patients, but in the SAPIEN 3, the Partner 3 trial, patients who underwent Tavor actually had better results than those who underwent surgical AVR. In the trial examining core valve, patients also had non-inferior results to surgery. And so that was a very exciting finding that we can open up this opportunity for a less invasive procedure to patients with low risk for surgery.
Yeah, can you kind of talk about why it's helpful for patients to have this option and, like what it means for these low risk patients now?
Certainly. So Tavor is a lower risk procedure in terms that it's not as invasive. So patients can have a procedure where we use a catheter, which means some needle punctures rather than an open incision and open heart surgery, and they can have a similar result with a valve that works and it no longer obstructs the outflow from their left ventricle. And so what this means is that patients can feel better and they can live longer with a less invasive technique.
I know that you and Dr. Brennan have done some research together about how treatment for aortic stenosis varies based on provider. Do you want to talk at all about how this will kind of influence that?
Hopefully, this opens up an opportunity and more people are aware of Tavor and symptomatic aortic stenosis in general, and that hopefully it is recognized better and patients undergo treatment earlier and more appropriately. However, it's clear that just having the option available is not the only problem, and that some patients are just not referred for aortic valve replacement even if they're appropriate for one treatment or the other. While this opens up the Tavor treatment to more patients, it's something that we need to work on in order to get patients referred for the procedure.
And I know that you guys have done some other research and disparities.
Yeah. What we found was that in patients who are female or in patients who are Black, historically both have been undertreated as compared to their male or white counterparts. While the disparities in treatment of Black patients have gotten better over time with the use of more Tavor, that disparity has not resolved in terms of female versus male patients. And so I would hope that the disparity with non-Hispanic Black patients would continue to improve as more Black patients are eligible for Tavor. And what I would hope is that female patients who we know have higher risk for surgery, for surgical aortic valve replacement, I would hope that more of these patients would be referred for Tavor based on these trial results. However, I think we also need to take a step back and know that this is going to be a multifaceted approach, that just having new data is not going to fix the problem.